Hello, welcome. Today I have the pleasure of speaking with Dr. James Hopkisson, who is Medical Director at TFP Fertility UK. Welcome, Dr. Hopkisson.
Hello, thank you very much for having me back to talk to you.
Today we're going to be discussing BMI and fertility. It can be a very sensitive topic and can be quite triggering for people to discuss or have be told by a doctor that it's something that they need to look at. So I'd love to ask you some questions around it. Could you first of all give us a very quick definition of what we mean by BMI?
BMI is a simple calculation. It takes into account your weight in kilograms and your height in centimeters, and can be easily calculated. It's your weight divided by your height squared. And there are a range of BMIs where you can be classed underweight, ideal weight, overweight, and obese. And the impact of your weight and height in fertility is something that we recognize and is important. BMI is not ideal. In some cases, there will be issues with calculating BMI that can be at the extremes of low weight, but also those people who are more muscular, athletic, because obviously muscle weighs more than fatty tissue. So we recognize it's not a perfect measurement, but it's the best that we have to gauge effects on health. That's fertility, as well as cardiovascular health, diabetes, blood pressure, etc.
And how can BMI negatively, a high BMI or a low BMI, negatively impact fertility, whether that's natural conception or assisted reproduction?
So there are many factors that come into play when you are overweight and going into the obese category in terms of fertility. And that may be purely ovulation, can be about follicular development. It depends where you are on your fertility journey. But in essence, being overweight or being in the obese category does affect rates of spontaneous conception. It decreases the effectiveness of many of our fertility treatments, increases the rates of miscarriage, unfortunately, and poses risks in subsequent pregnancies. So optimizing weight is really crucial prior to thinking about falling pregnant, but also when embarking on fertility treatment.
When you said that it can impact fertility success in an IVF cycle, for example, you mentioned that it might be to do with follicle development. How can it negatively impact follicles growing?
If we start with purely the dosing side of an IVF program, it is more difficult to tailor dosing regimes to the individual with those people who are overweight and obese. And response can be far more unpredictable. What's the basis of that? It can be to do with how the follicles respond, the quality of the follicles. A lot of metabolic factors come into play that affect follicular development. But very simply, it's working out what dose to give somebody. And we know that people who are overweight will require more medication to get the same yield of eggs in an IVF program. Equally, going to ovulation induction, those people needing ovulation induction, we know that our treatments are less effective as your weight goes up, and there will be sequential changes in effectiveness going from overweight to obese. And I think one has to look at what are the definitions. When you're using BMI, a healthy weight or healthy BMI is 18.5 up to 25. Over 25 is considered overweight, over 30 obese. And with increasing weight, you will see a decrease in effectiveness of fertility treatments and an increasing risk, both of the fertility procedure, but also of pregnancy going forward. And I think we have to bear that in mind as well when we're talking about fertility. When you're looking at the outcomes, we want a successful outcome. The best outcome from a fertility program is a healthy mother and a healthy baby. And being overweight, being obese, does affect both mother and baby's health in pregnancy, and afterwards. So we need to optimize weight and health before starting fertility, for spontaneous conception, but also fertility treatment.
You mentioned that the BMI creeping into the overweight sort of section and then into obese. Do you see, how does that kind of affect fertility in terms of the severity of it? Do you see that a steady incline in problems?
It's certainly, with every increment or increase of body mass index, you will see additional risks. And in a fertility program, we do invasive procedures, and there are practical aspects, but also, we are placing in our IVF cycle, you're putting a needle into somebody's pelvis. And unfortunately, there are risks attached to that. If you are overweight or obese, the complications can be that much worse. When you're looking at any operation, laparoscopy, open surgery, if you have a complication, if you are overweight, you are more prone to infections, venous thrombosis, wound breakdown, and generally, we will need to optimize health, because the increase in weight, studies from the World Health Organization has shown that the rates of obesity have tripled since the mid-70s until now. So, it's something that we all come across in our practice, and, we want to optimize our fertility care and offer the best success rates for everybody coming to see us. And, that starts at the beginning and saying, these are the things that you have to do before you're trying to get pregnant. Preconceptual care is not just about taking folic acid and vitamin D. It's stopping smoking, decreasing alcohol intake, and optimizing your BMI. And there is a really good reason for doing that.
Mm-hmm. Great advice. Now, it can feel, I'm sure to many, as though it's almost like a personal attack on someone in terms of sensitivities around discussing weight. It can be very personal for people. So how do you manage that when you're talking to patients who might be feeling sensitive about weight?
I think everybody has the right to see somebody, a doctor, a healthcare professional, to talk about aspects of their general health. That has to be done empathically, in a patient-focused way. There are ways of saying things. There are ways of consulting. And I think at the outset, we have to say to people, we want to give you this advice to make your fertility journey better, to give you that desired for family. And these are the steps that you need to take. It's not judging you for your past lifestyle. It's trying to give you help, advice to move forward. And things are changing. We have to recognize that we want to help people, but we have to be safe. We have to make sure that we are doing the right things by the patient in front of us, but also their future pregnancy. And many people will say to me, well, you see lots of people who are overweight falling pregnant naturally. And they will. And I cannot deny that. And those people will put a strain on their bodies. They'll put themselves at risk. But when we are using medical intervention to help somebody get pregnant, one, we want to get the best outcome for them, but the safest outcome. And I think it's exploring those issues rather than saying, you're overweight, come back and see me when you've lost weight, which sadly I do here. It's saying, these are the things that we need to do. Keep in contact. We will work through this and educate. And I think this is where we need to start educating much earlier on about weight and its impacts on health and fertility.
Such great advice. And you're right when you said it can be frustrating for people who see other people get pregnant naturally, for example, when they may be not in the fittest shape or have a higher BMI. I know personally that I found it frustrating when going through fertility treatment and watching everything I'm eating, taking so much care in what I'm putting in my body, and yet people are falling pregnant who are eating McDonald's every day. That can be really frustrating. But having the right medical team behind you, like TFP Fertility UK, like yourself, consulting people where you're giving that support and advice with a plan, rather than go away, come back when you've lost X amount of weight, can make it feel like you've got someone on your side who has your best interests at heart for medical reasons and for optimal success.
Yeah, and we have to take every gain that we can get to optimize success rates. When you're looking at the safety of treatment, especially with IVF, if you are looking at egg retrieval, sedation, safe sedation during egg retrieval, our anaesthetists will feel much more comfortable if you have a BMI below 35. And in exceptional circumstances with medical review, you can push that a little bit higher, but you have to acknowledge that the success rates are going to be lower. So those people who are overweight, significantly overweight, practically as a doctor treating patients, it can be difficult to do egg retrievals. Egg yields may be lower because we can't access the ovaries as well, but also the sedationists, anaesthetists looking after you while you are made comfortable during the egg retrieval are having to make sure that you are as safe as possible. And again, that's some of the rationale for bringing your BMI down, is to make it safe.
What would you say is the optimal BMI for IVF success?
I think that a BMI between 18.5 and 25 is ideal. Being overweight, 25 to 30, we will see good pregnancy rates, and that's why the NICE guidelines suggest that the NHS should fund IVF up to a BMI of 30. Many units will put in restrictions for treatment and use BMI as one of those restrictions, and most units will feel comfortable treating up to a BMI of 35, predominantly because of those risks that I explained about sedation and the actual practical aspect of retrieving eggs. And there have been a number of surveys looking at Canadian, US, and UK practice about IVF units using BMI cutoffs as a way of keeping people safe and advising people at the outset as to what they will treat, at what level of BMI they will treat up to. And I think, that will be with us. Certainly one would, any operation, whether you're having a knee, your hip replaced, there will be advice and guidance given to you about how to make your outcome better. And, optimizing your weight will decrease your risk. And, going into pregnancy, of course, that's really important, because if you have a BMI of 35 and in pregnancy have weight gain, an average weight gain in pregnancy is 10 to 12 kilos. So your BMI is going to incrementally increase, which puts you at risk of preeclampsia, diabetes, high blood pressure, to name but a few of the obstetric complications. And being overweight and obese is one of the most common factors that obstetricians now see in their practice, and managing the complications of that. So, you know, preconceptual preparation is really, really important. You know, we haven't spoken about preconceptual care, the need for folic acid increasing, and why that's needed. But you know, I'm sure we will touch on that in a second.
In terms of low BMI, how can that negatively impact fertility?
So low BMI is quite interesting because the physiology of ovulation and weight loss, an extreme weight loss below a BMI of 18.5, can give you problems hypothalamically in the brain, the hypothalamus, pituitary, the signals that are sent to the ovary to help to drive ovulation can go awry because of low body weight. So correcting that is important. And you know, if you can gain weight, and it's always very difficult to tell somebody who is underweight or slim, who's always been naturally slim, to put on weight. But again, there are benefits, especially if there are ovulatory problems. But also, again, coming into pregnancy, if there is little metabolic reserve and you develop hyperemesis, unable to tolerate solids and fluids, that margin that you have is significantly decreased. You don't have the reserves to deal with pregnancy. So, you know, correcting your BMI, and again, being underweight and the causes of being underweight are incredibly complex, probably not best managed and discussed with a gynecologist. It needs to be recognized, you know, the issues around body weight, body image, and coming through for fertility treatment. You know, you have two extremes of a spectrum with the markedly overweight and the markedly underweight. You know, there are issues at both ends that we have to deal with empathically and get the right people involved in the management. But yeah, it's a different problem, but one that shouldn't be ignored.
What about male fertility and BMI?
So from a sperm perspective, there are a number of studies and meta-analyses that have shown that markedly overweight men may have lower counts, may have lower motility, and have lower spontaneous conception rates, as well as having problems in assisted conception. That is intertwined with leptin, estrogens, peripheral conversion of estrogens affecting spermatogenesis. The NICE guidelines do recognize that if you are markedly overweight as a man, changing your lifestyle will affect the quality of your sperm. And we now know through studies looking at DNA damage of sperm, lifestyle for men is very important, be that testicular warming, what goes in, affecting the environment sperm is developing in, is very important. So we can't underplay that either. Unfortunately, the vast majority of restrictions in fertility and assisted conception are more targeted at women because they are going through the invasive procedure, they are going through pregnancy and minimizing the risks there. But if you have a chap who is markedly overweight with oligospermia, low count, or poor motility, asthenospermia, you've got to say to them, changing your lifestyle may improve your sperm parameters. You may have an increased spontaneous conception rate. You may avoid, when you go into an IVF program, having to use ICSI to fertilize your eggs by improving sperm parameters. So again, it's all of these gains to improve your chances of success. So yeah, the chaps have to sort themselves out as well and get as healthy as possible, using multivitamins and decreasing the, if you like, the environmental impact on spermatogenesis.
Absolutely fascinating. Thank you so much. This is so insightful. I would love to ask you a little bit about TFP Fertility UK. What is your BMI limit for IVF and establish guidelines around that?
When it comes to actual treatment, most IVF units will set an upper threshold for BMI of around 35. There will be some units that will push the envelope a bit up to 40, as long as there are no medical comorbidities, and will often require a individual to see an anaesthetist for assessment before treatment. But the vast majority of units will set an upper limit of BMI for IVF treatment of around 35. Ovulation induction with clomiphene, letrozole, slightly more blurred boundaries, but again, you have to say that the success rates with those treatments are increased if you decrease your BMI. Rates of ovulation go up. So, you have to put this into perspective for the individual, that if you are investing time, emotion, money into fertility treatment, you want the best outcome. This is how we're going to achieve it. And, bringing down your body mass index by 5% may increase your rate of spontaneous conception. It will decrease your miscarriage rate and, may well bring you into the criteria for NHS funded treatment. So, it's getting the right advice to put the right plans in place. And, we have to look at people as individuals, but we do have to have a set of safe operating guidelines that clinicians, nurses are able to advise people on. So there is a framework, and the NICE guidelines outline that quite nicely, as do the American Society guidelines, ESHRI guidelines for fertility treatment. And all of them will say, optimizing your weight, BMI, pre-conception is a good thing. So I'm happy to see anybody. I will sit down and say, these are the steps that you need to take. You need to take higher dose folic acid if your BMI is over 30. So instead of a 400 microgram dose, a 5 milligram dose, because the rates of spina bifida are increased as your BMI goes up. So giving them that sort of advice is very, very important.
Absolutely. I'd love to ask you, if, for example, you had a BMI of 30 and you brought it down to 28, would that make a real difference?
I think it would. One, you will feel a lot better. You are safer. So to quantify, will you get another 5% success by dropping your BMI by a couple of points is very difficult to say, because there are so many other things that go into a successful IVF cycle, ovarian reserve, sperm quality. So, if we can eke out a little bit in lots of different places, getting 2 or 3 extra eggs without that person putting themselves at risk of hyperstimulation syndrome, for every egg, there is an increase in success, whether that be in a fresh cycle or cumulatively taking the fresh cycle and frozen cycles into account. So yeah, if you are healthier, hopefully your eggs will be better, your embryos will be better, we will have embryos to freeze. So
is it correlated to better egg quality if you have a healthy BMI?
I think you've got to say that anything that environmentally that impacts on egg and sperm quality, and weight is one of those. If you have a poor diet, processed foods, high sugars, you are going to have more oxidative stress on your egg sperm. Gamete quality is not going to be as good. How do you quantify that? and say, you know, by cutting this out, you will have a 10% better ovarian yield, is more difficult. But it is proved in studies that, you know, egg yield will go up if your BMI is down, because dosing becomes easier.
What about miscarriage and stillbirth? You mentioned there may be some research showing links between BMI.
Yeah, certainly if your BMI is elevated, going from the normal range to overweight to obese, rates of miscarriage increase. You know, in the obese range, miscarriage can be 25 to 27% higher, depending on what study you look at. Stillbirth rates, congenital abnormality rates, so the one that we try and protect against by giving folic acid, spina bifida, is increased. But also in children born to overweight mothers, you know, they are potentially going to struggle with weight and metabolic disorders in childhood. The Barker hypothesis, which says, you know, your intrauterine environment predicts your health going forward, cardiovascular health especially. So we need to be looking at, you know, optimizing everything for everybody.
This has been so insightful, as I mentioned before. Thank you so much, Dr. Hopkisson, for all of your advice today. For anyone who is looking to discuss BMI or anything related to fertility, please do head to our link in bio and contact the team at TFP Fertility UK, who would be very happy to have a chat and help you with your unique journey. So thank you so much for speaking with me today. It's been a pleasure.
Well, thank you very much for having me, and look forward to talking to people and being open and advising them the best way that we can to help them with their fertility journey.